Hi, I'm Carissa Caramanis O'Brien. I'm here at the National EMS Culture of Safety Strategy Conference in Arlington, Virginia, and I'm here with Drew Dawson with the National Highway Traffic Safety Administration. Welcome, Drew.
Thank you very much. I'm delighted to be here.
Very good. So can you tell us a little bit about the Office of EMS at NHTSA?
Well, sure, I would be delighted to do that. The National Highway Traffic Safety Administration, as you may know, has been involved with emergency medical services for over 40 years. You may know us best for our development of the national standard curricula for all levels of emergency medical services providers. We initially became involved with emergency medical services in the late 1960s and early 1970s to improve the care of patients on the nation's roadways. But we have subsequently obviously realized that in order to improve the care of motor vehicle crash patients, we have to have an emergency medical services system that cares for all patients of all sorts every day, 24 hours a day, 7 days a week. So our goal is to support a comprehensive emergency medical services system in our nation. We do that through projects of national significance, such as National EMS Education Agenda for the Future, such as the EMS Agenda for the Future. That's the National Emergency Medical Services Information System, where we have about 14 million records about what's happening in the nation's EMS system. We have the National EMS Advisory Council, and we provide staff support to the Federal Interagency Committee on Emergency Medical Services, which is an interagency group promoting coordination among the federal agencies in emergency medical services. So we have a small staff, but we work hard and do a lot of interagency collaboration with all of our federal partners.
Small but powerful. So you mentioned the interagency collaboration, and I think that that is particularly interesting here in that we're seeing, a few agencies come together to really place a priority on this culture of safety project, and I think that's a bit of a precedent, and it's kind of impressive. Would you speak to that a little bit?
Well, sure. Interagency collaboration is an extremely important part of what we do. It's important in terms of this project, but actually almost every single project that we do is an interagency project and is supported through interagency effort and through sharing of funds. So there's a tremendous amount of often unrecognized but interagency effort that goes on in emergency medical services in the nation. This project, the Culture of Safety project, is a project that is co-funded by the National Highway Traffic Safety Administration and also by the Emergency Medical Services for Children program at the Health and Human Services at the Health Resources and Services Administration.
And what are you hoping to really achieve with the next day and a half of meetings? You're bringing together a number of really smart folks together in the same room. What are you hoping to get out of it?
Well, great question. First of all, I think we hope to learn from industry experts outside of emergency medical services, that there are a number of experts, and we've heard from some of the airline industry, and we hope to hear from others of what is happening in other industries. I think sometimes, as in any industry, we have a lot to learn from experiences of others, so we hope to learn from experiences from others. And then through the brainstorming of all of the various sectors of the emergency medical services community, that we hope to have a lot of good brainstorming and information sharing and some suggestions and future directions that we can take forward over the next couple of years through the American College of Emergency Physicians and in concert with the EMS community that help us to define what this culture is. So this is the beginning, the very beginning stages of helping to define what this culture of safety will be for emergency medical services. So this is, I think, the very important first step of a historic journey to take us to embark on the step of developing a culture of safety.
Very good. Well, thank you again for joining us. We appreciate it.
We're delighted. Thank you.
Again, this is Carissa Caramanis O'Brien coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia.